Welcome to Build for Bharat, where you and I learn from the builders and makers for Bharat. I'm your host, Sanjay Jain. Today I have with me Kiran Anandampillai. Kiran is the Volunteer Advisor Technology to the National Health Authority. Kiran, welcome to Build for Bharat.
Hey, thanks, Sanjay.
Kiran, the National Health Authority has been leading the space in terms of creating new APIs and interfaces that connect multiple hospitals, insurance companies, and the NHA itself. This is interesting because it changes the technology landscape and how companies can interact with each other. But even more exciting from the consumer side, because now for the first time, there's actually a possibility that an individual could have access to their health data, which is currently sitting with multiple providers. So Kiran, talk to us about this landscape, how it is changing, what opportunities does it throw up for people who are building for Bharat?
Hey, that's a great question, Sanjay. And as a quick background, the National Health Authority is implementing what's now called the Ayushman Bharat digital mission. And the objective of the mission is actually to produce a set of digital public goods, a whole bunch of things that like UPI has done in the financial sector, but for the health sector. And so the mission is looking at three areas of where the digital public goods will be produced. The first one is what you already spoke about, which is how do we get all of this health data that's sitting across a multitude of providers to come into the hands of the consumers and then empower these consumers to be able to use it for their own better care, whether it's with other doctors or with insurers or even with AI systems that may be able to give them a second opinion. And so that's the first digital public good. We call that the health information exchange and consent manager. It's based on the same architecture. If people are tracking data, they might be familiar with it. It's similar to the account aggregator, and that's one of the first digital public goods, probably the one which is currently probably the most advanced stage of development. The second one is between actually payers and providers, and there's a lot of challenges today that a hospital faces when it comes to actually tracking and reconciliation of all of these health insurance claims when you have an inpatient admission and care. So the second public good is called the health claims exchange, and that deals with, imagine that you will have an API where for any of the insurers of TPAs in the country, you have a single claim format and an API where you can track your claim from the time you actually file that claim in for pre-auth all the way to payment. And so that's the second public good that's in development. And the third public good is called the Unified Health Interface, or UHI. And the idea is really to bring interoperability into digital health services. So the most common service you can think of is, say, for example, teleconsultations. So an idea here is, can your doctor use any app that they like? And can you use as a consumer any app you like to find the doctor, find a spot when he's available, make a payment, exchange health records completely interoperably? And that will really make a huge difference to teleconsultations, because if you think about it, for doctors, the best experience today is when both the doctor and the patient use the same platform. And with UHI, doctors can now tell all their patients, especially the repeat and review patients, that, hey, you can find me on any app and you'll be able to do a teleconsult with me. So we think it'll make a huge difference to teleconsultation. So all of this is something that the National Health Authority with the Ayushman Bharat digital health ecosystem is kind of orchestrating, and it's doing this and it's allowing people to come in, and you can start as builders for Bharat. We have something called the Ayushman Bharat ABDM sandbox. So you can find that at sandbox.abdm.gov.in, where all of these three building blocks I'm talking about, especially the health information and consent manager, is already live. It's in production, and many people are already integrating with it. So anybody can come in, integrate with this, and actually take solutions live to market. So happy to share with you, for example, from a government perspective. So we now have many companies which are trying to build apps for consumers where consumers can collect health records. And the government is also doing that with Arogya Setu. So if you log in today with Arogya Setu, you can actually see a little icon on the top called ABHA, ABHA, which stands for Ayushman Bharat Health Account, where you can actually get your health ID equivalent, which is now called an ABHA, and you can actually start collecting your health records from any institution you go to. But it's not just Arogya Setu, it's an open ecosystem. We have at least 5 other companies which have built apps, PHR apps for consumers. And then we have a whole bunch of hospitals, providers, and people who make software for hospitals and labs who are also becoming ABDM compliant. So it's an exciting time to be building in the healthcare space. We think this is going to, like in UPI, create tons of opportunities for a variety of players who want to contribute in some place in this ecosystem.
Kiran, that's very interesting and exciting because it brings in multiple players. And for the consumer, it's an opportunity to get all the data in one place. It's an opportunity to get access to a much wider range of service providers and for simpler use cases such as a second opinion, where you can actually take all your data to somebody and get that opinion, and so on. These are now vast opportunities to serve the customer well. Overall, I can see a great time coming up for everyone involved.
Yeah. Thanks, Sanjay.
Kiran, thanks for being on the podcast. I'm quite excited by what you told us and eagerly waiting for many of these things to go live. So thanks.
Just finishing up, Sanjay. So the Health Information Exchange Consent Manager is already live in production at a national level. So parties can start integrating with it and actually go live today on the sandbox. Both the Health Claims Exchange and the UHI are just coming into the sandbox in the next couple of months. So really think that the next couple of years is going to be really exciting for the health tech space.
Thank you, Kiran. I think that's wonderful news for all of us. Thank you for tuning in. This has been another episode of Build for Bharat, where we feature bite-sized discussions with the architects who are building India's inclusive digital future. Build for Bharat is a part of the Bharat Inclusion Initiative, where we support entrepreneurs who are building for Bharat with inclusive products. We are on the web, Twitter, and LinkedIn. Do write to us with your suggestions and requests to feature a guest or a topic. Build for Bharat is available on all major podcast platforms: Spotify, Google Podcasts, Apple Podcasts, or wherever you get your podcast fix from. We will be back again with more insights soon. Subscribe now to never miss an episode.